Hello, my name's Alex Bowie, and I will be speaking about ALS. So ALS actually stands for amyotrophic lateral sclerosis. It is a nervous system disease that affects the nerve cells in the brain and spinal cord. It causes loss of muscle control and gets worse over time, eventually causing death. There is two types, sporadic and familial. The French neurologist Jean-Martin Charcot actually identified the disease in 1869, but it's also more commonly known as Lou Gehrig's disease, after the Yankee baseball player. He was diagnosed in 1939 and died 2 years after the diagnosis, and it kind of brought a lot of attention to the disease. So here's some diagrams of the anatomy of it. Over here, you see this is what a normal, healthy motor neuron looks like, and a person with ALS, you have like the degenerating motor neuron. Which, how I mentioned, it affects muscles and I'll go more into it, but basically it just affects the way the motor neurons communicate to the effector muscles. This is another diagram of just everything that it affects. So it does affect the upper motor neurons, which consist of the brain. The lower motor neurons would be the spinal cord and the brain stem. Eventually, all your voluntary muscles do stop working. So a little bit about the physiology. Normal motor neurons consist of tightly controlled circuits throughout the body that allow for voluntary and involuntary movements through innervation of effector muscles and glands. So the upper and lower motor neurons make a two together are a two neuron circuit. The upper motor neurons originate in the cerebral cortex and they go down to the spinal cord. And they release glutamate. So that's also where they differ. Lower motor neurons begin in the spinal cord and they innervate the muscles and glands and they release acetylcholine. So the movement of the signal, the signal begins in the primary motor cortex. The upper motor neuron integrates a signal as either inhibitory or excitatory and initiates the corresponding movements. It continues down to the spinal cord into the lateral cortical spinal tract, which synapses onto the lower motor neurons. The lower motor neuron then transmits the signal from the upper motor neurons to the effector muscle. So ALS affects motor neurons, just like I've been talking about it. The upper motor neurons lead to scarring or sclerosis of the lateral cortical tracts. So this is what happens when you have ALS. The lower motor neurons lead to muscle wasting, or also known as amyotrophy. So combined, it produces progressive muscle weakness and atrophy and spastic paralysis. Progressive muscle weakness happens. Death is inevitable and typically occurs from respiratory failure. There isn't one precise etiology. It's a combination of like many different mechanisms that have been proposed of what actually causes this to happen. One of them is called excitotoxicity, which just means that there's an abundance of glutamate. So typically symptoms will begin in the hands, feet, arms, or legs, and then it spreads throughout the whole body. The muscles become weaker as more nerve cells die. Pain is not common in the early or later stages. It doesn't affect senses, your heart, or it doesn't directly affect your sexual functions, but it could affect it indirectly. So common ones are muscle weakness, trouble walking, clumsiness, slurred speech, trouble swallowing, twitching, behavioral changes. Diagnosis, it's hard to diagnose because there are other diseases that mimic ALS. So ultimately, you'll just providers perform multiple tests to rule these other diseases out. This workup could include electrodiagnostic tests, which are EMGs, and nerve conduction velocity tests, blood and urine tests, a spinal tap, radiology, muscle or nerve biopsy. The ALS Association does recommend anyone that gets diagnosed to get a second opinion from someone that is specialized just in ALS. So there is no cure for ALS. Treatment right now just focuses on symptomatic management. You would need to get an interprofessional team, which consists of like physical, occupational, speech, respiratory, and nutritional therapies. There is a medication that just got approved by the FDA called Riluzole, and it's the first drug that has prolonged survival. In AI, there is something called Answer ALS, and it basically collects data from over 1,000 people, and it creates this comprehensive picture of disease that includes clinical, genetic, molecular, and biochemical information. This is available to clinicians and scientists. Something that is underway is GNS Healthcare, which uses that database from Answer ALS to perform studies. It turns it into a model, and it will demonstrate computational experiments, such as like how the disease can react to a certain drug. ALS affects, well, 90 to 95% cases are sporadic. The incidence rate in the US compared to the world is about the same, 1.6 per 100,000 people annually. The incidence does increase with age if you are white, if you are female, and sometimes about like 10% is genetics. There is about a 3 to 5 year average survival after diagnosis, but about 30% of patients live longer than 5 years, and 10 to 20 live longer than 10. And these are my references. Thank you.